and I'm pleased to say that I am joined on stage here by Helga, Joanna, and Susanna. And I will first like to start off by introducing myself. So I'm Anne Helme. I'm from the MS International Federation, one of the joint leads of the PROMS initiative. I'm very pleased to be here today, sort of standing in for Emma Gray, who's one of the other co-chairs of the PROMS engagement coordination team. So first, I'd like to start by thanking Dr. Rivera. There were lots of themes and ideas that she talked about that we're going to try and pick up in this section. Sorry, how do I turn it on? What do I use? Is it this one?
So the big arrow to go forward,
Okay,
yes.
sorry. So my first task is to briefly give an introduction to the PROMS engagement coordination team. We have two co-chairs, Emma Gray from the UK MS Society and Helga, who we have on stage here, who's connected to MS South Africa. And then we have people affected by MS from various parts of the world. We have Susanna and Joanna here on stage with me, and Guy and Angela who are joining us online as well, actually, and here we see everybody. So Emma, Angela, and Guy. And we also have Annie and Michael, who are from MSIF and the UK MS Society, who help support the work of the whole group. So you have seen this diagram before in Paula's introduction. And I wanted to put this up again to remind you of how the people affected by MS engagement coordination team is a really central part of the whole of the PROMS initiative. So the engagement coordination team overall is a group, but it's really important to remember that it's made up of individuals. And this is important because we know that MS is a complicated, complex disease and that it affects every individual differently. And if we don't acknowledge this and take this into account, then we're not going to be successful in achieving the goals of the PROMS initiative overall. So to help address this, members of the engagement coordination team are embedded in all parts of the PROMS initiative, in the executive committee, the scientific committee, and in all of the working groups. And they also come together as a group, as a team, to work on specific activities and projects. So this means that, hopefully, we ensure that people affected by MS are part of all of the discussions and decisions that take part as part of the PROMS initiative, helping to set the strategic direction for the initiative, working alongside researchers to design surveys, setting parameters for literature reviews, designing and interpreting interview questions. I think one of the really valuable things the engagement coordination team do is to continue to challenge us to continue to focus back on real life problems. The PROMS initiative is not an academic exercise. Having people affected by MS in all of the working groups means that there are new and different perspectives as the groups work through planning and executing their different activities and projects. And I think we've made a really good start towards seeing how science with patient inputs looks in action. So that's my little introduction. And now, before I hand over to the engagement coordination team and you get to hear from them directly, this session is supposed to be participatory, and we really want to get your involvement. We've got a poll coming after we've heard from the engagement coordination team, but we need to practice this first. Let's get you warmed up for participation. So for those of you in the room, please use the QR code on screen here. I think those of you joining online should be sent the link directly. So our practice question: what was the most recent thing you ate before you joined this meeting? And we'll probably give you about 30 seconds or so to answer that, and then I'm hoping somebody's going to show the answers on screen. Right. Okay, the technology works, you can see. So I believe that the ones that come up biggest are the ones that more than one person has chosen. So here we go. So the next slightly more serious task is going to be using this same method, where we're going to ask for your input on a word cloud that is very similar to this. Okay. I think we're going to stop this one, close this one down for now. And because I'd really like to hand over to our members of the engagement coordination team, who are going to give us some of their personal reflections around barriers to inclusivity. And I would first like to invite Angela, who is online, to kick us off.
Dr. Cruz Rivera actually mentioned most of what I was going to say in terms of having challenges with respect to one's race or ethnicity, sexual orientation, gender even, but also socioeconomic level or status and geographical location. I'm in the US, and people tend to think of the US as the contiguous 48 states, but there are two non-contiguous states, but also territories. And there are challenges with respect to where one lives. For instance, I have friends in Puerto Rico who've been devastated by hurricanes recently. So the infrastructure challenges of visiting clinic, getting care, those are preeminent in their mind. Also the sensitivity to cultural norms, especially with respect to revealing intimate details of how MS affects them, not just physically, but mentally, emotionally, spiritually, sexually, and financially. The lack of standardized care. So if you're in a large urban area, you have access to MS clinical care that differs from that which is available in rural or suburban areas. Just imagine trying to get to clinical care without broadband access and living in Alaska. So just imagining those challenges. Additional barriers are healthcare providers who lack familiarity with MS, but also who are less culturally competent to understand how to interact with people across cultural barriers or cross-culturally. Not understanding that sometimes it will be difficult for a patient in a particular population not to defer to the medical professional. And so rather than being self-advocating or engaging in shared decision-making, deferring to the clinician and their perspective, which might not reflect the quality of care or the quality of life situations with which that person is living. And so from a clinical management perspective, because I'm on working group 2, I think those are the barriers that meet us with inclusivity. And I think those are not just in the US, but across globally, ensuring that we're meeting everyone where they are with MS. So thank you.
Thank you very much, Angela. I'm going to turn straight on to Helga.
Thank you for that. Angela and I are both in working group 2, and we've just had the pleasure of Robert sharing with us the result of the landscape analysis. And for me, as a person with MS, I must admit I was enormously disappointed in the result, and especially the fact that there are probably 3 PROs being used, and the amount of effort that we've put into it in the last 2 years to find out that there's just really still so much work to be done. The feeling that one has as a person with MS and sitting on a working group that you're going to try and develop PROs, or at least identify them, is that these PROs are not going to be dependent on the patient. The starting point is going to be the clinician. And there was a question asked by a gentleman a little bit earlier where he said PROs are being used, they are being answered. So that fact remains that there are PROs, which is very encouraging. But it's going to be up to the clinicians to share them so that that good knowledge and that good work can be implemented and not have to reinvent it all. So to my knowledge, there are no PROs that are in use in South Africa. And once again, I can't believe that is actually true. There must be PROs that are just not published or we know of. The other thing with PROs is that what Dr. Samantha also said, that the inclusivity, we need to be very cognitive of socioeconomic and literacy levels when we develop this, and also the use of it within clinical care. The other thing that I feel is that clinical trials offer a very good opportunity to collect PROs because people are already invested in the process. Thank you.
Thank you, Helga. I'd like now to turn to Guy, who's online.
Hello, can you hear me okay?
Yes, we can.
Okay. So before I start, I'd like to say a huge thank you to MSIF and the UK MS Society for the opportunity to share these thoughts. I'm very grateful and not bitter, despite the tone of this short message, how it may be received. Okay. I believe one barrier to inclusivity in the context of healthcare services, Working Group 4, is the crucial issue that Samantha introduced, and that is of trust. Healthcare services, despite being underpinned by humanitarian values and commitments, are necessarily rationed. This inevitably means resources are tightly managed and their allocation is prioritised. The method in deciding how healthcare decisions are prioritised is often opaque. I live in a westernised society where systems are provided by and supported by a mix of private and public organisations. This represents a complex context for establishing and sustaining trust between people providing care and those receiving care, because there is often a clash between service and self-interest. From the perspective of someone receiving care, it is often unclear what the primary motivation of the healthcare organisation is: to serve citizens or to serve the executive board. When finance dominates the healthcare narrative, the foundations needed for a robust therapeutic alliance between people providing and receiving care are conspicuously absent. Essentially, this means there's a lack of mutuality, meaningful collaboration, and trust. There is significant imbalance in power and a feeling of two distinct factions where healthcare services make decisions for people with MS as opposed to with people with MS. In this context, healthcare services are the gatekeepers. It's paternalistic. For me, they have control over how effectively I can participate in society, look after my children, and have a reciprocal and fulfilling relationship with my wife. In the UK, I rarely have any interaction with a healthcare professional. For me, my last routine appointment with a neurologist was in 2019. When I speak to my MS colleagues, we often feel marginalised, experiencing a perpetual lockdown in our own homes, if you like. I'll end there by thinking about marriage. If you do not have trust in a marriage, you do not have a relationship that will stand the test of time. To improve inclusivity, we must consider the concept of trust. Thank you.
Thank you very much, Guy. We'll now move on to Susanna.
Okay, it's on. Great. So we all talked a lot about inclusivity just right now, and we've seen the presentation, and it's basically summing up a lot of my thoughts as well. But another thing that I've noticed in my work, not directly linked to MS, but also to MS, I work with Ukrainian refugees. There's a huge problem with language barriers, so they don't even have access to healthcare. So how are we going to give access to PROS if that already exists? So basically we see language barriers, we see digitalization as a consequence that we have been facing, especially with COVID-19, which has been a good point. I mean, remote work has enabled me to work quite well during the period we faced. But everything that has good sides also has cons, and for some people it might just not work or not be the way. So I am quite aware that we have digitalization, we also have the age cap. And look at people who are older, can they use a computer? I was quite terrified when I noticed, no, that's not the case. Not everybody can and does have digital skills, the things we do need in today's society. So those are my thoughts, as well as people with MS are not only people with MS, we also have different health conditions that can play a role and different disabilities. What do we do with somebody who has an intellectual disability? How can we support them? So there are a lot of questions, and none to which I have answers just yet, but I'm sure we will find them. Thank you.
Thank you, Susanna. Now to Joanna.
It's on, okay. I have got a lot of free thoughts because of course I was on the MSDA meeting and I have got a lot of notes and everything. But the first of my thoughts, it was like we are here as a patient to upside down everything, and sometimes I'm thinking that our main role is to complaining and saying what is wrong and why is wrong. And for example, when I was seeing today's second presentation from PROMS, and it was this iceberg, and I was watching on this, and it should be upside down. It should be another. It should be another way to show the how do you work with the MS. But what I would like to say about the language, it is very, very important, because last year on the PROMS meeting, I learned that it is something like fatigue. Because in Poland, we do not have fatigue. In Poland, we are tired. And really, we can't, I didn't find any accurate translation to Polish, the fatigue. Because in Poland, we are tired, and of course, we are going to the doctor, and we are saying we are tired, and he is saying everyone are tired, so it's not a big deal. Fatigue is a word. We should translate it to the Polish. So if we would like to be inclusive, we really need to take care of the language and of the diversity of the languages. And I am also on the group e-health, and I think it couldn't be a less inclusive group like e-health, because e-health group is not inclusive because it can't be, because it's an e-health. That means there are people who, with their solution, we are working and everything. It's available for the people who are using some devices, some electronic devices and so on. So it's very difficult to be inclusive on this group and think about the inclusivity. So I think it is a quite big barrier. And also in my society, we need to remember that we are very big group, the people with the MS, but we are not the one, like one group. We are living in some bubbles. And we are thinking that this bubble are connected in some way, but it's very difficult to build any community based on only the disease. Because very often these bubbles, even not seeing each other, they don't want to meet each other, they don't want to talk each other. Once time was organized some event, and organizers try to cover all very inclusive areas of the MS and everything, and it doesn't work at all. because the people doesn't come because it was too much for them. So I think it's also very important to remember, if you are inviting someone, we need to be very sure for what, who, and how to write the invitation. So that's all. Thank you.
Thank you very much, Joanna, and thank you again to all of our engagement coordination team members who gave some very open and honest perspectives about barriers. And I think I would have loved to have been able to allow all of you to speak for much longer, but just from those short reflections, we've seen just the diversity and the number of barriers that we are going to need to work to overcome. And I'm going to see if I can collect some more. So again, we're going to launch the next poll. So again, use the QR code on the slides or online. And I'd like you to think about, think about from the perspective of your community, whether as a researcher or a healthcare provider, a person affected by MS, or maybe somebody who's working in policy or decision making. What do you think is your biggest barrier to inclusivity that you would like? What's the one that you would like to overcome first? So yes, we can launch the poll and we can start showing some results coming up. We'll probably leave this open for a minute or two to give you a chance to think about this. Thank you to everybody who is contributing. I think we can see, again, a lot of very similar themes coming up, both reflecting Dr. Rivera's talk and also what we've heard from our engagement coordination team. So now we've got I think, a very good sense of what some of the barriers are to participating either in PRO research or using PROs in a clinical or self-management setting. Or even using PROMS to influence policy decisions. I would like to now open it up to everybody again, and to either for any comments or reflections that you have in terms of perspectives on the barriers that we've heard about and that are in this word cloud, or ideas for improvement. So, what are some of the things that you might have tried in your setting or in your country to overcome some of these barriers? What have you tried to do to reach people that don't usually engage, or how have you broken down these barriers to enable them to join in with different activities and really help with this equitable participation? So if you're in the room, feel free to get up and use the microphones. Otherwise, please put some of your comments into the Q&A feature on Slido, and I'd be very interested to hear from those. Whilst I do so, if any of our engagement coordination team have ideas in this, either reflections on what you've heard about barriers, or in terms of ideas for breaking them down, please do feel free to kick us off.
Shall I go? Helga. One of the other things that came up amongst those words was the lack of knowledge, and the use of PROs could pose quite a challenge because patients may feel that a electronic device or a paper and pencil assessment prior to an assessment is going to replace the relationship that they have with their clinician, and it's going to become like phoning a call center. And that is a big challenge, that people might say, no, I'm not interested in PROs because I want to see my doctor, and not understanding the value of having so much information up front before you actually see your doctor.
Thank you, Helga. I got Holly.
Hi, Holly Schmidt from Accelerated Cure Project in the United States. We have a patient registry type of program called I Conquer MS, and it enrolls people affected by MS to contribute to PRO research and other kinds of research as well. And we notice when we look at our demographics, it is not representative of the US population with MS. We realize that's a problem, so we're trying to do something about it. We can talk the talk, but we have a hard time walking the walk, because the people involved in the leadership often don't come from those communities. So we formed a council called the RIDE Council, which is Research, Inclusion, Diversity, and Equity. And we put a call out to our community members saying, if you belong to a group that you feel is underrepresented in research, raise your hand if you would like to come to meetings and participate with your peers and help us understand what we can be doing to better engage people from your community. And so that's been active for several months now, and they're working with us on different outreach activities, and we'll also be offering their services to other scientists or other researchers who are looking at their work too and saying, how can I better recruit a more diverse cohort? How can I better serve all populations? And they don't know how. We have the experts that will be able to help them. And I think it's really important to engage everybody in as research participants, because that can open the door to other types of opportunities. And I'd be curious how the members here on this panel initially got involved in this PROMS activity. Was it out of the blue, or is it because you had some connection previously to research? But I feel it's important to make sure that those, just to get in the door with being part of research, and then you know more about it, and then you can make contacts and hear about these opportunities to influence other research initiatives and strategies and goals. So thank you for your presentations today. They were really, really wonderful.
Thank you, Holly, and I think we'll definitely be in touch to see what we're able to learn from the RIDE Council's efforts as well. I don't know whether there's anybody from the ECT who would like to comment on how you got involved in the PROMS initiative or other types of research initiatives. Oh, I think Emma would like to comment.
Hi, Anne. I was going to make another reflection rather than answering that question. Is that okay?
Yes, of course. Let's go ahead.
A reflection that I was going to share was listening to Samantha's talk and then thinking about barriers. It's kind of really shocking low reporting of ethnicity data in research. So it feels like a very low-hanging fruit. At the bare minimum we can do is to actually report on who is doing what. So I feel like we should all, including thinking myself as a funder, be using our own influence in those kind of structures that we sit in to ensure that reporting is absolutely mandatory. So for our funders, we've started to say, for clinical research, you have to report this data to us as a mandatory thing. So I wonder if, very bare minimum, we should all be kind of trying to enforce that in whatever structures we exist in. So that's not a big solution, but I feel like that's the bare minimum we can start with.
Thank you, Emma. I think you're right. We have to start with some of the things that might seem more simple to implement first, and we need to keep building on these. Is there another question? Yeah.
Okay, hello. My name is Peter van Galen from Holland, actually living in Belgium. I'm part of the Belgian MS Society, and with that they have a patient expert center where they asked people with MS to become a patient expert. And so we're reaching out to the bigger public, actually, going to schools, going to universities, but also talking about PROMS. And that's also articles being written in the monthly magazine. So that's ways that we're trying to reach out to people that can difficultly be reached because they're not online. So, but they might have access to the books or any other things. So we try to reach all people, not only the young people that are IT experts, let's say, but also the older generation that likes papers. So that's one of the things that we're doing. Thank you.
Thank you very much for sharing that experience. And again, I'm sure I'll be in contact to learn more about that.
Yeah, maybe the question from Ollie was more about how we select the people affected by MS to be part of the engagement coordination team. I don't know if, you know, Michael or yourself want to comment about this, because was,
yes,
you know, was a process, was, you know, it's not that we
Yes.
choose from, you know, we.
Yeah. Michael, would you be happy to comment on how we recruited and put together our engagement coordination team?
Sure. Can you hear me?
Yes, we can.
Great. Yeah. So we used the MSAF member network to recruit, and we sent out to all our members invitation for people to nominate up to 2 people, and then sending in their motivation for why they were interested in partaking. And then we interviewed in several stages over 30 people for the now 7 positions. So there were actually quite a nice breadth of people from different parts of the world.
Yeah, thank you. We're almost out of time, but we think we have the last question to Professor Komi.
No, a very short question, and that is about the representativity, because we might have a quite clear selection bias, not really for the engagement coordination team, but generally speaking for any type of survey, that the type of person who may really be more liable to react and to fill in the questionnaire may be a certain prototype of person with MS, and vice versa, there could be another type of person who doesn't really, let's say, be motivated or interested, or may have a psychological type of approach. So then the question is there any possibility to try really to, at least in the selection of those who have to be contacted, at least to try to have a good representativity in terms not only of ethnicity and income and so, but also, for example, in disease severity, and also maybe on some type of psychological profile, because it may have an important role.
Yes, this is very relevant when it comes to the global survey that is being developed currently by Working Group 1 and that we'll hear about shortly. It is very challenging, I think, to get a completely representative sample of the MS population if we're going out for that wide survey. And I don't know anybody that has completely cracked this. It's a challenge, I think, for anybody who is doing research in this field. But we need to do everything we can in terms of reaching out through all channels and networks that we have available to us, through all MS organizations that we have connections with, through digital platforms where people with MS may be using and interacting with each other, and yes, trying to reach people with all of those different demographic and clinical characteristics. And I think it's important as part of that survey that we are capturing those characteristics, so then we can subsequently look at where there is a mismatch between the survey responses received and what is the kind of the prevalence of those characteristics in the MS population overall, where we know that data. And so we may be able to weight some of the responses accordingly. But we have a very efficient research team that is helping us produce and deliver this survey. So I'm hoping that they will be able to assist us with some of those issues of representation. So I need to wrap up this session, and it remains for me to thank everybody involved with the engagement coordination team